right, let's talk about your healthy living. We all know the importance of the circulatory system, and you know, guys, varicose veins, whether you're pregnant or a little bit older, but when you're having trouble sending blood from your limbs back to your heart, this is actually called venous insufficiency. So in this condition, blood doesn't flow properly to the heart, and it causes it to pool. The blood pools in the veins in your legs. So Dr. Leonard Glade, Touro's interventional cardiologist, joins us now to talk about the symptoms and also the treatment. Doc, thanks for being with us. It's such a common thing to have as we get older, or maybe it's one of the hormonal changes when you're pregnant, but talk about what it means for your overall health.
Yeah, so a lot of people with venous insufficiency can have symptoms. Some of them can be cosmetic, like varicose veins, but a lot of people can have symptoms like heaviness, leg swelling, itchiness, burning, and even some restless leg at night.
The restless leg, that is also extremely common. When is it time to go see you if you're feeling any of those symptoms? Because it could all be confused for so many other things.
Yeah, that's another great question. I think that the symptoms of venous insufficiency can sometimes be confused with other stuff.
Okay.
So I would say if you're concerned, to go ask your doctor, whether it's primary care or it's a vein specialist. I think that's what I would recommend.
Okay, the most common symptoms that you just said, the itching, the heaviness in the legs, a lot of people have dealt with just symptoms after COVID, for example. You were saying that clotting was very common after COVID. Talk about what you can do to be able to heal from having either a blood clot or from just having those symptoms in your legs that signal, all right, I got to get my circulation going here.
Yeah, so the mainstay of treatment needs to be conservative, and that's number one, leg elevation and compression socks.
Okay.
They may be tough to get on. We have some therapies that can work around that. But the mainstay needs to be compression.
Okay.
That helps the leg swelling. That can help alleviate some symptoms.
Right.
And then as the symptoms progress down the road, you can start talking about some procedure-based therapies,
right?
Which are usually in the office, done with no anesthesia, and you're really up and at them later in that day.
That's so interesting. You were talking that varicose veins, which is very common. A lot of people will do a cosmetic, poor guy, we keep showing his legs over and over again here, but we keep, one of the things with varicose veins is that there is a cosmetic fix. Does that help your overall health to just make them less obvious?
Yeah,
really, right?
I mean, it does. Your overall health, I think it helps a lot of people, because they're seeing it, they're looking at it every day.
Right.
So I think getting rid of it does help their
psyche.
Their psyche, but does it prevent heart attacks? Does it prevent strokes? Does it help them live longer? No, and I have a real frank conversation with my patients about that. Anytime you're undergoing a procedure, you kind of have to understand what the risk benefits are.
And that is so interesting because there are a lot of people that when they start to feel those symptoms in their legs, and for example, you may not want to exercise more because it hurts, but what do you say the benefit of exercise for the circulatory system?
Any time that you can get up and moving is going to help your circulation, and that activity and that repetitive motion can kind of help circulate the blood. So we do encourage that at every visit. And
last question for you, does early intervention with this prevent heart attacks? Does it prevent bigger deals in your life later?
So no, I wouldn't say treating venous insufficiency helps prevent heart attacks, but I think what it can do is what you just mentioned, whether people who have symptoms and they feel like they can't move and they can't get up and do their day-to-day, I think it does offer them an opportunity to get back to that.
And that is so important. Absolutely. Dr. Leonard, thank you so much for joining us today. And once again, guys, if you want more information on this, we will post it a little bit later after the show. Appreciate you joining us.